2021, 07:30 at 0027. That's 2021, 07:30, 0027. So 12:27 a.m. July the 30th, 2021. This is an update from yesterday's incident with my mother and father and the door that's right behind me in my bedroom, and the medical assessment, and just trying to give a 24-hour just about from 10:58 or so to like 11:30 ish of like my neck and my shoulder, and making sure that that's fine so that I can send this video in and see about further evaluation for post-surgical care for my shoulder dislocation, as that is important to follow up with this. So this is going to be the first view, which is going to be forward, frontal facing. So my chest is aligned. I'm in a sitting position here, and I'm about as straight up as you can be, basically. Now I'm going to change positions to the face. I'm going to face south and turn right. So this is the extent of my motion. With this, I'm having difficulty with my neck here to here, from my ear down to here, with my left shoulder, which is not the shoulder that had surgical reconstruction on it. That was my right. The left was the one that took the brunt of the force of the door right there and the ground, for me to force it, to keep it. So you can see how my neck is going forward a bit because of the tension here. And because I was braced like this and this, and that's an issue. But I'm hoping that that kind of just clears up. But I want to make sure, because like I can't full range with this as much because of right here especially, and I already know my pain tolerance is far too high to understand if there's significant damage. I don't see on camera either visible bruising, but inside here, right here to here, like between the muscle here, I can feel like the tendon underneath and inside of that. If you were to push in that, like right here, but internally, kind of how there's a hole here, but inside and in between this bone, the bone right here, making kind of a triangle feeling. This right here, that is causing serious, that's causing pain. This right here. And it's pretty tense here, but I don't see any bruises. And this is the, again, the south and right facing from my other position. Here's my arms and shoulders up a bit because they're on the arms rest, and here's them not. Back on the arms rest, and not. Arms rest, and not. So back, and I'm now facing north and left. You can see here, trying to point again on my left shoulder. The cap here hurts, and right in here. So I'm going to go back to neutral. And shoulders up. And then down. And down would be on my legs. Shoulders up. And down. Up. And down. So this actually doesn't really hurt. On my right. Probably should still assess that for damage, but the left definitely. And also kind of looks like, it doesn't look different to me, which is good. That's very reassuring. And just so, where the chair I'm on is planarly level for usage with my computer desk and my keyboard for a proper wrist placement. So it isn't not at an angle. It is not accentuated at all. Its pivot is not pivoted for the seat. There is not a lumbar push forward for leverage, and there's not the back is not straight, but it's not. I'm not touching it at all right now. I'm just on my own level with both my feet firmly planted on the ground. So I'm not using my lower body at all to change the muscles here. See, I can't really feel like I can turn my neck all the way here to do the full stretch. It's way too tight right here. Way too tight. Especially right here. And this is pretty tight, but not in the same way. Don't know if I'm right or wrong about this, but feels like I can do this easier. Going from my right shoulder crossways to the left, or down, and then crossways to the left. Down, and crossways to the right. Then back to neutral. So anyway, this was 2021 0730 at 0036. This is a medical records update from incident on 2021 07 28. Sorry, not 29. 28. So this would be. Well, this is still almost 24 hours because we're in an hour. We're 25 hours difference. So, 25 hour update on incident 2021 07 28 at about 23 or 22 48 approximately to now. And for my right shoulder surgical update for Dr. Gonzales and his team at Children's Hospital in New Orleans, and MD Anderson in general, and any other orthopedic surgical team that I have in the future.